I think the beautiful thing about Endocator is it actually reminds us that maybe the effort alone isn't enough. We need data, we need knowledge. And that's what the Endocator provides. And because to your point, I mean, it takes literally 10 seconds and you actually get a pre reading within about 1 to 2 seconds. So the final reading comes up in 10 seconds, but in 1 second, you basically have an idea if you're where you need to be. I am so excited to announce the launch of an innovative new product from Vista Apex Solutions called the Endocator. The Endocator is the first ever chair-side device that actually allows you to verify and test whether your canals are clean before you obturate. Utilizing ATP as a biomarker, this device is able to let you know that the canals are clean before finishing a case. How valuable is that? Visit Vista Apex Solutions at vistaapex.com to learn more about the Endocator. Because remember, you can't see clean on an x-ray. Welcome back to On the Cusp. I'm your host, Dr. Brett Gilbert, with another exciting guest. This guy really lights me up. He inspires me. Dr. Randy Cross. I want to explain that, this gentleman that I have here today is someone who is really a pioneer in my eyes, an innovator, an inventor, and a big thinker. And I love that because, man, do we need more of that in this world and certainly in our specialty. Randy Cross graduated magna cum laude with molecular biology and biochemistry degree. He worked in the biotech field before going into dental school and then entering endodontic residency. He tested various methods to determine when root canals were clean. And that's really one of the big points of our discussion today is this idea of how do we actually know if a root canal is clean? Is it just the effort or is there more to it? And Randy is really, he's got some exciting things happening about that. We're going to talk a little bit about his invention, the Endocator, which is a biomarker reader of ATP, which was, in my mind, just sort of a brilliant stroke in terms of having a quantifiable measurement of understanding if the canals were clean. I love this about your bio, Randy, that before you went into endo, you were a dental director at a clinic, Clínica de Salud del Valle de Salinas and Salud para de Gente, providing care to underserved populations in Watsonville and Salinas. This is deep to my heart because it's the work you do for just the love that you get back that to me is the most gratifying. He does have his dental degree from the University of California, San Francisco. He completed his endo residency at USC. He's an advisor for several dental companies. And he runs Watsonville Endodontics in Watsonville, California. So I want to give a big welcome to Dr. Randy Cross. Welcome to On the Cusp.
Oh, it's great to be here, Brett. So yeah, thank you for having me as a guest. I always love to talk me some ATP.
Yes. And just for the record, we are doing an early morning recording, most especially for Randy on the West Coast. So Randy, as you sit there early this morning, what are you feeling grateful for today?
I feel grateful just to be in this spot in life. Like, I mean, I'm in my own office where, I'm a morning person, so I like to kind of get the fun things done in the morning and kind of let things that I can focus my family in the afternoon. It's just I almost feel like I have to be pinched because everything I've kind of wanted in life has kind of happened, and I'm on your podcast talking about my fun little side project. That's just so yeah, I'm grateful for a lot of things, but man, it's really great to be here today.
Awesome. And yeah, sometimes it's like you have to look back to remember that today was the dream. This is what we dreamed of. We were just talking about this here I'm in my studio recording my podcast, also was a dream. So sometimes it's important in the day to day, we get sort of stuck. We always want something more. We're looking ahead, but sometimes it pays to look back and remember you've accomplished so much. So super proud. So, okay. So Randy, I want to just kick it off. What in general inspired you to become a dentist and then ultimately to become an endodontist? Because I love understanding the background story of what someone, feels in their heart to actually pursue what is a very long and arduous pursuit.
Yeah, so the goal for dentistry was more of just I came from a family that really emphasized education. So each of my brothers kind of did amazing things. And then I was kind of more into healthcare and I looked at the different options and like there's medicine and things like that. But dentistry just really resonated with me. It's like you go to clinic, you do need to, there's no on call. It's just a really good lifestyle choice. And so that's what kind of motivated me to go dentistry. And then when I decided to go endodontics, it was, I did dentistry for 7 years. And so I did a kind of couple different areas. And there's a couple reasons. Like one is general. It's like, man, it's hard being a general dentist. You have to do fillings and dentures, and the next patient's extraction. It's just really hard to be good at everything, and you end up, and it's just really hard to kind of. It feels like spinning plates. Like there's so much going on. Well, then my friend who's an endodontist is like, yeah, I did a root canal an hour ago. I'm gonna do a root canal again in the next hour, and I do a root canal. So you do this exact same thing again and again and again, like, and as I'm sure you experienced, it's pretty repetitious. So it's pretty easy to do a good job. Um, and then also, like you mentioned, I was a dental director at Salud Par La Gente and Clinica de Salud del Valle de Salinas, and it was great, and it was a really great experience. But I really like patient care. I liked interacting with all my patients and getting to know them and talk to them. And then those roles were a lot of, it's a lot of academic, it's a lot of like emails and a lot of just administrative work, and that's great for some people. But it's just, I definitely I get some energy off my patients, and it just the day flies by, and, that's kind of my story and how I went to go, endo residency.
I love that. I love that. I've had it many times, but just yesterday, I had a patient say to me, "Don't you get sort of tired of doing the same thing every day?" And I said, "Honestly, every tooth is different. So it's not like you're doing the same exact thing every day. But we certainly can apply these beautiful skills. And, what we're able to do as endodontists for patients and saving their teeth is incredible. And I know there's a lot of question marks around endo in the ethernet and, around the world. We just are releasing an episode with Mehdi Rahimi and Ali Nasseh on the safety of root canals and some of the advancements that have come around. And so I want to talk about this concept for those that are listening of, the concept of sort of culturing bacteria in canals. When I came up, and probably in your literature studies as well, Randy, it was always this bacterial culturing, and it was a very imperfect and certainly inefficient science. Trying to collect some specimen, it took days and days to get the results back. Obviously, we know bacteria aren't often viable for that long outside of their environment, so it was abandoned. And I think, though, our forefathers had this concept of wanting to have some verifiable test to actually determine if the canals have been disinfected. That's like back in the 1970s. Here we are, 2025. And out of all the brilliant minds and people who have come through this specialty, Randy, I want to acknowledge it's you that actually came up with an actual realistic concept that actually goes much deeper than just bacteria. So with that, can you talk about, you're an innovator, and I look, I know you're going to turn red in the cheeks and no one likes to hear all this about them, but you're a pioneer, you're an innovator, you're an inventor, but more than that, you're a thinker. So can you talk about the journey from, maybe being in patient care, maybe having some type of scenario and coming up with this idea that now is actually a unit that you can buy called the Endocator, which actually can verify at the chair side whether the root canal system is clean. Randy, the floor is yours. I am so excited to hear your story.
Well, that set me up for a long one here, and then it's a little bit of a story, so
We have time.
hopefully your audience is a little comfortable, but, yeah, so I went back and did residency, and then, I'm in Northern California, the residency's in Southern California. So I told my wife, like, I know this is crazy. I know we have 2 kids. I know my first kid's 2 years old, but I wanna go to residency. I got into school, like, are we moving? We're staying, and my wife's stayed in Northern California, so it was every Sunday night I would fly down there, and every Friday morning I'd drive or fly back, and it was just exhausting, and then we're doing endo residency. We're reading all these classic papers like you're mentioning by Schrogen and Sunquist. And, see like the rate of a root canal success is 66% if it had bacteria in it at the time of fill versus 95% if it had no bacteria. And, as a general dentist, I kind of thought there's some like advanced cool toy that root canal doctors had to like do things to make sure it's clean or not. But then I get to residency and it's like, there's nothing. There's like, you could try to grow the bacteria, which doesn't usually grow in a petri dish anyways. You could do PCR or you can do all these advanced things that take weeks and really expensive. And I'm a biochem guy. I'm like, and I worked in the biotech field, just like in the intro. I'm like, there's got to be a way. Like, you can't. It's probably not direct. You're probably not going to grow bacteria, but there's a Bradford assay for protein. And I kept on this. My wheels were spinning, and this is the first semester, and I'm studying for my finals. I'm like, this is crazy. Like, there's got to be a way, an easy way to figure out if it's clean or not. So I'm trying to study for the test, but I couldn't stop Googling just like every single thing under the sun And so I checked a couple different ways, and like I mentioned, there's, protein assays, which go from, like, blue to green if you're clean. I tested a couple of those, and that's not very exciting if and you wait 2 minutes to see if it changes color. But the one I kept on going back to was ATP, and it so, just, like, it seemed like it makes sense. So eventually I asked my wife, like, "Hey, I know I'm in residency. I know we're burning the candles in the both end. I know we're financially strapped, but I think there's a pretty cheap, easy way to see if my root canals are clean. And would you give me permission to buy this lab toy for a couple $100? And if it doesn't work, well, that's my Christmas present and birthday present, and that's fine. But if it does work, man, I think this could be really useful." And so I remember getting these ATP testers and, checking out and my root canals, and oh my God, it's that easy. When I start the root canal, this 10-second test, it tells you I have high ATP, which is not surprising. We're just starting the root canal. After I do my rotaries, it goes down a little bit. And then after I'm done, ideally it's low, but sometimes it's higher and sometimes it's sky high. And so I remember thinking this, like, this is just great. This is amazing. Like, there's got to be people using this. And sure enough, this is like a new thing. So then um, yeah, so that was how that my inspiration is just like this time of residency with, Dr. Schechter and all these advisors over me asking, "Is my root canal clean enough to fill? Is my root canal clean enough to fill?" I'm like, there's gotta be a way. Like, there's not looking in the microscope and how clean your walls are doesn't necessarily correlate to how clean the canals are. So that was kind of the long answer, just residency, all this chaos. The last thing I need is this other thing. And I'm like, oh my God, now I figured out a way to check the root canals clean. So then that kicked off getting my patent, talking to different companies, and why I'm here today. And yeah, it's been an amazing ride, and it's been really cool to meet all these wonderful people.
Wow. Wow. And that's how you and I met. And I'm so grateful for it because, I think there's so much inspiration in this. First and foremost, many of us do get ideas, but, with so many challenges, so many responsibilities, and really often time burdens, ideas die because, you just don't have the time, the effort, and the energy to do it. But you didn't feel that way. It really burned inside of you. And so once you actually recognize it, can you talk a little bit about why ATP is such a great marker because of its variability? We're not just talking about bacteria.
Yeah. So the ATP, I think the greatest thing about it, the it's just such it's not complicated science. It's not like dividing up, DNA chain. And at first I apologize. I know your episode is really like a overall view of concepts and like motivational and lots of great speakers. And I'm talking such nitty gritty details, but as you can tell, I love the details. But yeah, so why ATP is awesome is that it's not complicated. You have ATP, which is energy. It's in every cell on planet Earth. And so, people who lift weights can think of ATP as like lifting their muscles and things like that. Bacteria, is fuel for causing infection. But this ATP energy, if you combine it with one single enzyme, the luciferase enzyme, it'll cause that enzyme to light up. And the cool thing about it is it's super, super efficient. So you can get down to 10 bacteria cells will start lighting up this So every below culturable levels of bacteria in a root canal, you will get levels of ATP. This thing is so sensitive that at the point where you stop culturing bacteria, this thing can still detect it. So you can start to get those shades of gray. And the coolest thing about this test is ATP on these new devices in 5 seconds you get a reading. So it's not like you're waiting for days. It's not like you and I are busy. Us doing a root canal, we can't wait 5 minutes for a test. We need the ATP enzyme to hit the molecule, hit luciferase, light it up, give us a result in almost, pretty much instantly, so we can kind of modify our treatment if we need to kind of to take that information into account. And the cool thing about it too, like you mentioned, is it's ATP. Like, this thing doesn't care if it's nerve tissue, vital, blood, apical fluid, saliva. So the downside and upside is it just tells you if it's clean or not. So say you have a vital case and you have that 90%, 95% success rate and you get a higher score, yeah, you might want to look around a little bit, but like it may not matter that much. And so I've had these cool cases where I'm doing a vital case, I do my 5-second ATP test where I get a higher score, and then I start fishing around like, well, that seems kind of funny. I thought it was done. I thought it'd be cleaner than that. So then I go ahead and I look. I'm like, oh, there's an admesial, or like the C-shaped canal, and you have another entrance. I'm like, oh, that's why. I didn't get all of that C-shaped canal clean, and it's getting a higher score. So that's kind of the cool part about it, but the downside is ATP. So if you have blood coming out of the apex, if you have like a perforation and you get a high score, you just, you take it with a grain of salt and say, I want to manage this. I'll go ahead and manage this perforation. I'll manage this saliva contamination trying to leak into my test. And, but it may not necessarily mean your root canal is going to fail. It just gives you a little bit, a little bit more information on what you can do to improve your outcome.
Yeah, yeah, wow. I mean, it's that's what the thing that I think conceptually before I had a chance to use it, and I have had a chance to use it extensively in my own private practice, but was just this idea that it's not just bacteria or biofilm. It's blood, it's saliva, like you said. I mean, what I love about it is the ability to critically think about where you are in the moment where you're ready to finish. Now, to some degree, I would say that the challenge of this device has nothing to do with user interface, or it's so easy to use. It's easy to
Yeah.
sample. It couldn't be easier to read. The big thing is saying to yourself, in this moment, would I rather be ignorant and bliss, in bliss of ignorance because I did all the things. Sometimes I use the best solutions. I instrument it beautifully. I've done the laser disinfection, and then I test it and it's still not a low number. And so you say to yourself, like, wow, like if I didn't have this information, I would have assumed that by my effort alone, I had accomplished the goal. And I think the beautiful thing about Endocator is it actually reminds us that maybe the effort alone isn't enough. We need data, we need knowledge. And that's what the Endocator provides. And because to your point, I mean, it takes literally 10 seconds and you actually get a pre reading within about 1 to 2 seconds. So the final reading comes up in 10 seconds, but in 1 second, you basically have an idea if you're where you need to be. So for those that, want to, obviously, we want to be efficient, right? Efficiency to me doesn't mean that you do a bad job. It means that you really do a great job of moving, thinking, staying on your toes, not being lazy in any way, being efficient in your movements and how you work with your assistant. And so to get a reading that probably with 10 seconds of indicator time and the sampling time, which is maybe 20 seconds, I would say that within probably a good 60 to 90 seconds, you have your reading. That certainly isn't going to slow anyone down. So sometimes it might mean, you know what, maybe I should actually, if I'm looking down there, I think I probably should enlarge it to another size, or I'm going to run through the laser sequence again, or whatever that looks like. But man, at the end of that case, you feel so good that you did right by the patient. And this is a way that we've never been able to do right by the patient. So really, really excited. The other thing that I love about this is, as you can see, Randy is a much younger man than I. He came up with this concept in his residency. There is so much here. There is so much room for contribution from our younger doctors. And I think that we have to remember fresh minds, fresh ideas, different level of biases and conditioning. Because I think in the past, we've always looked to the older, more experienced clinicians as our guides. But see, I see it the other way around. We need this fresh energy. We need these fresh ideas. So I just think it's amazing. I'm really, really excited. So with that, Randy, so we've sort of broken down the Endocator. You've had the path to commercialization. I know Vista Apex Solutions, who is sponsoring this episode as well. Wonderful company who I love the people in that company. I've been, a KOL and working with them for over a decade, and they're just awesome. Was the path to commercialization more or less challenging than you thought? Because the reason I say that is I think it's a great way. Like, I think you've paved the path for someone else who might have a great idea. How difficult and challenging was it to actually get this to commercialization?
So yeah, so I was It's, I think it'd be easier now, and the reason I'm saying that twofold. I mean, A, during residency, I'm broke, so it's like to write the patent and do all this stuff and find the patent lawyer, it's more difficult than, like, now. So if there's a dentist with an idea, it's one thing. You can just kinda, just get some help in that regard. But nowadays, I mean, kind of like even just take a step back, I feel like even to get an idea for some of this stuff, it's like you can just use ChatGPT for half this thing. Like when back in my day, which is not even that long ago, I just go to Google, but now you can go to AI and say, "Hey, I'm looking for a non electrically conductive lubricant for endodontics. Could you suggest some ideas? And not that you would go then use this, but I mean, like, at least gets the wheels going, or even like, hey, I'm like, how do I build a patent for this thing? And then it could start spitting it out for you. So, I mean, I feel like the idea wheels can be accelerated so much because even in the last, what, 7 years since I came up with the idea, everything's changed so much. Or 5 years since I came up with the idea. But, but yeah, but I also want to go back to your point too about like, you're doing these procedures, you've done the thing, and you get these high scores. It's like, I feel like you have to take everything with a grain of salt. You have to have a growth mindset. You have to be like, I may not this, every tooth is different, and just kind of just get the feedback from this information. Like, okay, how do I refine my technique? Maybe I need to get apical suction in there. Maybe I need to go ahead and use the laser for longer. Maybe I need to, for this case, put the hypochlorite back in, do my exam, and then fill it. So you have to have some flexibility and a growth mindset with this invention because it's just information. If a necrotic case gets a high score, for me, that's a bigger deal than if a vital case gets a high score. So you can't like throw away everything you learned. This is just another tool. And kind of like, I'm not sure if you mentioned, but it's really affordable too. It's not like it's a couple bucks a test. It's not like $100 gentle wave, which users love it and it's great and that's wonderful. But it's just like it's a couple dollar test, and get whatever shaky thing out or laser thing out you want to do to try to get those scores to where you want it to be. But I think it's but yeah, so I kind of answered two questions with that. But I feel like nowadays it's not that difficult to find the patent process, get guidance on what to do, and hopefully find a couple great mentors like I did, like John Ferrone, who's helped me kind of navigate the dental industry, and Cliff Ruddle, who I met with Ruddle at the Residence, who kind of spoke about his journey and has just been very liberal at this time with me. So I met some just wonderful people on the way to help me out. And if people want help from me, I'd love to share. My personal email is ddscross@gmail.com. Anything I can do to help out, or if anybody has any ideas or anything that, in any way I can be a help to your audience, I would love to help out.
That's awesome, man. And we'll have all that linked up in the show notes for sure. And, you mentioned John Ferrone. I'm grateful for him. He pulled me into this very early on. Everyone knows I'm a tech junkie. I love to see what's developing, contribute anything I can in terms of guidance. But I do agree. What I love about the Endocator is it's really accessible. And I think that that's important because as a teaching tool, this is going to be incredible, obviously in private practice. But the thing about endodontists, in general, I would say they're so passionate about what they do, and we're always looking to get better. And I do believe that this allows us to really take a look in the mirror. And I love your point about, it's learning, it's learning on the go, but it's learning at the chair. And I think that oftentimes we think of learning away from the chair, and this is actually something that's been really helpful. And again, with all the new technology, I think it's also an opportunity for us to see how they really stack up. And I think that's exciting too. So with the technology going, where do you feel that we are in terms of technology and advancements in endo? Are we at the ceiling? Are we at the floor? What's your personal perspective on where we're headed, Randy?
I feel like let's see. I mean, I feel like this check marks another box. There's gonna be a lot more control because right now we've had CBCT technology. Like, we know how many canals there should be. We know how long it should be. We know how much volume it's going to be. So like that's kind of like been taken care of. These newer technologies to actually like sterilize it and clean it has really come a long ways. But I'm not sure if your experience with Endocator has been like mine. Like, it's not like like I feel like it parallels with the Hopasalo studies of the past, where like things don't get sterile instantly. It's not like you put something in and you shoot it the laser for 10 seconds and it's done. So I feel like this kind of check marks the list. Okay, we know how many canals. We've have these flexible NiTi files that can get down there now. We know we didn't miss anything, but did we, put our shaky thing in the canal or use our laser long enough or gentle wave? Did we do a low cycle of gentle wave or a high cycle? So I feel like that's been missing. And I think that this is going to really help out with that area of like, well, this case that's on a bridge with a large pericarditis, and it's the patient's on bisphosphonates. This has got to work. Like, it's just nice to have a test to be like, okay, we've done every single thing we possibly can. We're good to go. So I think this kind of pairs well with the newer technologies, and also the newer technologies too. I know you're kind of get showcased some of these things in the pipeline. There's some really cool stuff coming. So I'm pretty excited for especially like the laser kind of niche thing. I like the Edge Pro laser. But there's some other really, really cool things coming. So I'm kind of excited to be like opening up every JOE and seeing what new kind of toys we have to play with.
Yeah, absolutely. And look, to your point, I think what we're saying is this in some ways, the endocator can be a little bit of a bubble buster, because you do have all this beautiful armamentarium, you've used it to perfection, everything to your eyeballs looks right. And then the endocator tells you it's that. And so the thing to remember is I think we'd love to think that every time you put it in, you get a confirmation of a low reading. But my experience has been really surprising in a lot of cases where I'm shocked. I'm like, I
Yeah.
can't believe this, but I trust it because I know how it's working in all these different cases. So, again, to your point, to just throw a little extra effort, soak a little longer, another round, maybe enlarge a little bit. It doesn't take a long time. And then when the case is done and you see that good reading, you just feel so good in your heart. So I really appreciate it. So stepping away from the technology for a minute, what do you see as maybe the great, and I just want to get your perspective because I think it's so important to share people's perspectives and open each other's minds. But what do you see as maybe the greatest challenge for us in endodontics or endodontics in general over the next 3 to 5 years?
Yeah, I might go back one more time and just nerd out in the details for like
Okay,
one
go
more
for
second
it.
too. So don't feel bad if you get a higher score. And the reason is this is a 0 to 100 scale, and it's not a 0 to 100 scale if it's going to work or not. This is a 0 to 100 scale on your average root canal based on 1,000 patient study by Dr. Nagesh Bolla in India. So it's not like if you get a score of like 80, it's not like 80% of it's going to fail, or oh, I got a score of five is like this is a 95% success rate. It's just ATP. So it's just, so it's based on the average results. So I know we all like to think that all of our cases are better than 99% of every other dentist out there cases. But if you get a score 20 or 15 or 10 or 30 or 60, it's just based on ATP scales. So do take it with a grain of salt. And especially in a vital case, it's like, well, it might still work. It'll probably still work anyways, but just good to have that information. And, maybe next time I modify this, or maybe this case, I need it to work. I want to enlarge it. So I just want to nerd out about go back and kind of mention that.
And before
Um,
you answer, I'll add on to that is that, we're not predicting outcome. I mean, I think over time there will be more outcome studies. We see some beautiful case studies from Justin Kolnick showing beautiful healing. But when we walk into that operatory and we put that rubber dam on, our goal is to get it as clean as possible, right? Regardless, I mean, you might not get it as clean and still get a great outcome, but to be able to have quantifiable data that actually confirms that we have achieved our goal, which was to clean it as well as possible. We're never going to sterilize it. And so ultimately, oh, I shouldn't say that because you never know what's going to come next. But for now, I just want to acknowledge that. And you're right. And to your point, it doesn't necessarily mean that you're asking someone to do not fill if you're at an 80, right? That's not the point. It's guidance, it's data. And I think as scientists, this is really helpful.
Oh, and patients love it too. It's like, well, the first root canal failed. What are you going to do differently? Like, well, ma'am, we went in there, we confirmed disinfection with ATP. We reached the apex, we sterilized it, and as opposed to like, oh, I cleaned it really well, I cleaned it really good. Like that doesn't resonate as well as like, well, man, you got a score of endo score of 1 out of 100. That means that out of every 100 cases, you have the lowest ATP score, and we're ready to fill this case. There's nothing else we can do to clean this tooth, and just it's a
Yeah.
nice patients like to hear that, especially if they've had a failed root canal, 'cause, like, clearly, like, something didn't go right the first time, so why would doing the same thing twice and expecting different outcome be any different? And like, well, we now have these advanced devices, and now we can confirm that we actually cleaned up the tooth.
And we also battle, as I mentioned before, we battle these perceptions of root canals as being dangerous, creating toxic environment. And so, yes, we have all these beautiful bells and whistles, and we're doing so much more. And like you said, with cone beam, microscope, lasers, etc. But I do believe that Endocator provides some evidence that we really might need to truly defend this beautiful procedure. Yes, we have tremendous evidence basis in endodontics, but the endocator and these biomarkers is another level where we can refute some of these really, what we call disinformation about how root canals work and how effective they are. So, yeah, I think just so many beautiful benefits have come from this innovation, Randy. So, again, fully acknowledge you. So, as we do that, can just step into that question. I know it's not an easy question, but I'm just curious what challenges you foresee or are aware of in this moment.
Well, I think that just I feel like there's a couple challenges, and I feel like there's a grain of truth to it. Like, if you do a bad root canal and a patient has an infection, like and not that you do a bad root canal, but just if it doesn't work, yeah, they have a low grade infection going on, and especially the great news is we have CBCT, so we're able to catch these things before they become an issue. And I feel like there should be a good push to always do a great root canal. I feel like with the CBCT technology, there should be a push to make sure it actually worked. And I feel like with the CBC technology, if it doesn't work, we move to the next step. We do the retreat, or maybe do an apico or root amputation or things like that. So I feel like just with the modern technology, it's like, I feel like there is a I feel like there is a downside to having a low grade dental infection from a failed root canal. I think our goal should clearly be to never have that happen, or reduce it as much as possible. When it does, we have microsurgery to go ahead and correct that. And not that I would like to jump to an implant, but implants are pretty dang good too. So if we need to get to that step, we have option C. So I feel like there's a lot of misinformation, but also like I believe if you have a failed root canal, you're probably gonna have higher inflammatory markers in your body. You're probably have higher C-reactive protein. I think studies have shown that, and I feel like our goal should be to have that be as close to zero as possible. So I think that's it. Just with all the information out there, we have to do our best job, because patients can get the truth pretty easy. Patients can go get a CBCT and find out if it works or not. So we really have to be on our top game. This no longer you take a PA of an upper molar and everything looks fine. It's now you have this such detailed, Marita scans to visualize cracks or these micro lesions that just aren't healing. So I mean, we really have to be on our game to make sure that everything works, and that we set out to accomplish a goal to remove that infection.
Yeah, absolutely. And that's one of the setters of the table we did on the episode with Ali and Mehdi, which is none of us advocate keeping an infected tooth in your mouth. And I think that, there's a lot of communication and misinformation around that as well. So Randy, I know you're a busy endodontist, life is stressful at the chair, you got kids and everything. What do you do personally to reset, recharge, both during the day, like throughout your clinical day, staying centered, but then also when you're home and off for a weekend?
Yeah. So yeah, I'm pretty routine in a good way, in that I feel like I have like and I'm always overly ambitious. So in the day I kind of like set my list of things I want to accomplish, and I get like half of them done. And that's okay. So in the morning I like to get up and I like to practice my Spanish. So I think it's kind of fun to try to just try to keep up with something like you do with your podcast, or something totally different than dentistry. um, I like to try to take on new challenges. So the way I wake my kids up in the morning is I turn on our electric piano, and I'm bad at piano, and I'll play like the Big Bang Theory, and I'll just play some like Moana music and just annoy them to get them up. Like I mentioned, um, I have my parents I still are around. My wife's parents are still around, so I just love to hang out with them. I have my kids, so I take my kids to my son to the pump track, my daughter to aerials. On the weekend, my daughter's getting into surfing, so I'll take my daughter out and we'll go surfing together. And she's like a little mini mite. She's 11 years old, so to see her like in a little wetsuit and a foam board, and it's just like I'm really lucky too. So I grew up in this area in Santa Cruz, and to be able to, go to UCSF and then live in New Mexico for a little bit, and then USC, and now I'm like back where the area where I grew up, and just it's just like it's I mentioned to me, it feels like I need to be pinched. It feels like I'm in such a good spot in my life that I can practice Spanish and get my morning routine done, because I'm not sure if you're the same way, but I got to get it done in the morning or else it's not going to happen. So anything I really want to have
Absolutely.
done, yeah, I gotta wake up at my 5:45, just check off my exercise, Spanish, like, piano, one out of those three, two out of those three, and get that done. Go to my own practice, which I've set up, and kind of do that. So it's I have a pretty good routine, and it's just feels like I'm in such a good spot right now.
Oh man, good for you. To be grateful for your blessings is a such important practice for being present, but also from what I understand allows the universe to be reminded that you like blessings. So bring some more, right? So that's beautiful. Just a couple more questions and we'll get you back to your work today, Randy. What would be like your best advice to a dentist that wanted to go into endo? We know that the application numbers have skyrocketed over the last 5 years. What would be your advice? Because there's so many really incredible clinicians out there that want to be endodontists, but the opportunities are limited. So how would you advise them?
I would say probably get to know the program pretty well. So my program USC, if you were to go to Dr. Rojes and say, "Hey, I'm really interested in research, or I'm interested in your program, what can I do to help?" Like, "Hey, yeah, I know you guys have these research projects. Like, what can I do? Like, how can I be involved?" And I think that if you know the program director and you can go to and people know some of the ways to do it, you get good test scores, you go ahead and you go to the AAE meeting, you try to meet the program directors, but really try to help them out would probably be one way of doing it. And also, like, what helped me out is like I'm like Clinica de Salud para la Gente. I like went ahead and was like, I even got that job because as a white guy that spoke a little Spanish, and I think people got a kick out of that. Um, so so I feel like also, like, just be interesting, set yourself apart a little bit. And you don't really know where path your life's gonna take you. Like, I worked in the biotech field for a year, thinking they have nothing to do with like my career, and all of a sudden I go endo. I'm like, wow, I can actually dip into this a little bit, and I know how to play around with these assays and tests and things like that, and also for the Clinica de Salud dental director role, like, I didn't think that'd be really helpful. And then I go to endo residency and Dr. Rojas starts to try to interview me in Spanish. I'm like, you gotta stop. I can't like I can't like I like it's tough enough to respond in English, but so I think just keeping an open mind, trying your best, and if you don't do it, just have a growth mindset. Man, at least I tried. At least I gave it my all, and just try to get close to the program directors and just try to like be honest, help them out, be open, and be involved in with their program. Because then when they're looking at applicants, at least you get in that front door.
That's beautiful, man. I love that. It's like we know you're interested, but Dr. Randy Cross advises be interesting. And I think
Yeah.
that's really, really a really good one. Last question for you, Randy, and we'll get you off to your day. So, there's an 18-year-old being in front of you, and they are wanting to step into a life of blessings and contribution, just like you're so grateful for. What's one bit of tangible advice you could offer an 18-year-old? Just one thing they could do today that would take one step toward them finding what's going to fulfill them in their life.
I feel like just especially in college, just focus on that, do really well, get good, just do everything you possibly can to set yourself up for success. And my logic in undergrad was, oh, I just gotta like get through this, it just be the top that I could ever be, and then I'm done. I'm in dental school. And then in dental school, I'm like, I just gotta get the top of the class and just do my best, and then I'm done. And then, like, that's it. And then now I was like, I just have to get this idea, and then I get that through, and then I'm done. But so I feel like just kind of like be present in the moment and always give it your all. And just kind of like if you're running a marathon, I'm not sure if you run a marathon, but like you can't think of the next, 20 miles you have to run. You just have to think to that stop sign up ahead, that little tiny thing, and just kind of keep on going. And also just trying to take a step back and be like, man, I have like a beautiful wife. I have my two kids. I have, my friends around me. I have my family still has health, and just try to take the dual aspect of your overall goal, and then, but taking little bits to just put work aside, and then enjoy the weekend and go surfing with your daughter, whatever you do for fun, in your personal life.
Wow, man. Well, Randy, you are awesome, man. I want to thank you personally for this beautiful contribution of putting so much effort and energy into bringing Endocator to life. I believe it's an absolute game changer. I've been doing this for 22 years, and I think that there's so much potential, and it's going to be so exciting to see how it's applied and what we learn using Endocator. And for you personally, just your whole journey and where you are today, and the fact that you sit in your seat feeling so grateful and excited and passionate about life. So thank you for being a guest here on the Cusp. I'm so excited to catch up with you soon and just appreciate your time so much.
Hey, Brad, it's always a pleasure to meet you. From the first time I met you at Apices, speaking to the residents, you're always so uplifting and so motivational. So thank you for making this podcast. I love your guests. I love your show. So it's an honor to be on your show, chatting you up this morning.
Thanks so much, man.